see here. Whatever I said I was going to do over the break, I did that. And I did something else while I was thinking about it. And I need to do this for a bunch of the different folders, but I'm trying to keep on top of it. In last week's folder, hopefully by now you see all 4 parts because you've done those assignments, but you'll also see now at the bottom it says body dimensions and cavities makeup assignment. That was hidden. The way I did this last semester is only visible to people that were required to do it. But since last semester, I changed that approach. So you'll see that there. But if you were here last week, then you are not required to do that. That's for people that miss. However, if you were present last week, you might want to do that, or at least look at it. You're exempt from that assignment, so you don't have to do it. And if you do, whatever grade you get, whatever score you get won't be counted into your grade. I have, for several students over the years, over the semesters that I've been doing this, just tested to see what happens to their grade when I count it, even if it wasn't required. And it does have an adverse effect, very small adverse effect on your final grade to do these. A lot of students will say, oh, hey, let me just do that, and you can count it in my grade, and it'd be good to have an extra grade. But what I found is actually it doesn't help any at all. So being present and being exempted from that assignment is a good thing. But if you are interested in looking at these, even if you're not required to do it, you're welcome to. They're mostly made of YouTube videos and fill in the blank sentences following them. Actually, let me open this one up to talk about it. Okay, this first example is not that, but there'll be a video which I've gotten off of YouTube, and then some questions that have to do with that. This matching thing here is sort of in the question with the video to put the videos into this assignment. They have to be part of a question. But for this particular assignment, after this video, there's more questions down here that are still referring to that video there. Now, if you ever come across this sort of situation where there's a big white space where there should be a video, but there obviously isn't one, what a lot of people will try to do first is to click on the player controls, but that doesn't do anything for it. And actually, all the player controls have for when the video is working, that's just the play and stop buttons, which you don't really need. So that button there for any of these isn't really useful. But if you don't see the video in there, actually the title for the video is down below, okay? And if you just search YouTube for that title, you'll see the video. The easiest way to do that, if your browser is capable of it, just highlight the title, and with a right click, you should be able to do a search for the highlighted text. If you have Google set up as your search engine in your browser, then it should take you directly to that. So this is a link to that video because I put specifically that title into my search there. So you can watch it even though it's for some reason not showing up there. I was trying to put some video stuff into Blackboard. I guess back on Thursday or something like that. And I was getting some error messages on Blackboard, and YouTube's supposed to integrate with Blackboard pretty well. And so I wrote to the guy here on campus that handles Blackboard for us, and he looked into it, and it turns out sometime last year, Blackboard did an upgrade of their system, and in that upgrade, it broke the YouTube integration. And so I was getting a lot of people saying, hey, I can't see the videos, what's going on? And I couldn't figure out why they weren't seeing it because I could see it. But apparently something on Blackboard broke with its YouTube integration. So sometimes you might not see the video, but the way that I put them in here, the title to the video from YouTube is right there. So if you just look, again, search for that, it'll take you to the YouTube video there. And you can watch it there. So for instance, this video that's actually in the assignment, if I did the same thing and searched for that title there, I just get a link to the video right there, okay? Now I'm just doing a Google search for that, and it's actually giving me two different links here. One of them is a 13-minute video, and the other one's a 4-minute video. The actual title's cutting off, so it's kind of hard. Well, I guess one's body positions, one's plain. Oh, I see. That's weird. So it's the body positions one, but for some reason the title's got a colon instead of a dash in it there. Also pay attention, they'll have the duration here. So if you find multiple videos that seem to have the same title, these have very intricate titles, so they're pretty specific. But you're trying to figure out which video it is. The duration will also be listed down here. So this is a 13-minute video. So obviously it's going to be this one here that's 13 minutes. So use that information to find the video if you're having trouble seeing that. And like I said, something on Blackboard with the last update, it just broke the YouTube stuff. And I don't know when that's going to be fixed or anything like that. But if you can't see a video like this one of these assignments, it's titled there and you'll be able to watch it directly on video. Pay attention to the duration if that helps you figure out which exact video it's referring to. So, after a little while, when I was making these assignments, I started putting one open-ended question in. I just wanted to kind of keep track of who and when these were, who was doing these and when they were getting done. And all of the questions that are in this right here are auto-corrected. So if you were to complete this, it would just grade it and submit it. So I put in the open-ended questions so that it would have to come up in my grading list. And so that you'll see some of those. But especially the first few here in the semester, I made them before I put those types of questions in. And maybe sometime in the future I'll put those in, but not this semester. But those are available for everybody. If you'd like to, even though you were here last week and not required to do this, if you'd like to, because I really didn't talk about this information. The book describes it, but if you want to see another presentation on it, you can go here. And there's some questions that you can answer to help you understand a little bit better. This particular, or these two particular videos for this, you'll see it says Mr. Ford's class. Some of the videos I use for these come from this guy. He's just got a number of videos on YouTube. He's got an interesting kind of style. He's apparently an instructor for a class much like this somewhere else, and he just put a bunch of stuff on on YouTube. He has, actually, I don't know the entire number. Let's say he has 200 videos. 100 of them are freely available on YouTube. The other 100, if you want to watch them, you have to subscribe to them, and he gets some money from that. So if you like what he's doing and you want to see more of his stuff, you're welcome to subscribe to get that information from him. But it's not required for this class. That's just his particular business model for this. So he has a number of videos available on YouTube that I've got that I use for some of these. And I use other stuff too. But just this Mr. Ford guy comes up a few times. Anyway, so in last week's folder, I've made that available to everybody. It was always there, it just was hidden from you, and I've changed that. And I did the same thing for this week. So now there's a biochemistry makeup assignment for people that were late today or not here for the entire day. You will have to complete that. My intention is after class every week to just go through and check off the exemptions in the grade book in Blackboards, so you'll know whether you need to do it or not. If you're absent on any given day, then you know that you're going to need to do that. If you're late, and the people that were late today, I think it should be kind of obvious because they came in pretty late. You'll also be required to do those assignments. If you ever have a question about whether you are required to do that assignment or not, I just want to remind you, in the My Grades section, list all the assignments for the class and for the makeup assignments. There will be a little gray circle next to it if you're exempt. If there's not a gray circle, then you're not exempt from it. And it might be that I've not gotten around to doing the exemption. So if there's no gray circle next to a makeup assignment and you're like, I know I was there, contact me and just ask real quick if you're supposed to do this. And it might just be, oh, I haven't gotten to do the exemptions on that yet. And just double check with me. Or if you want to, you can do it. If you're exempt, then it won't affect your grade. If you're not exempt, then you need to do it anyways. And in either case, it's material that can help you out with stuff. Okay. So feel free if you ever want to complete those. For the ones that have the open-ended questions that I'm going to grade, I'll grade them whether you're exempt or not, because it doesn't tell me who's who in the grading. So I'll just go ahead and grade them, and you'll get the feedback on how you did on it, which you might want, even though it's not required of you. So, I remember. The thing that I did during the break that I said I was going to do, this folder here where I pointed out the link to the cases, one of which we're going to be talking about in a little bit. This is the lab practical folder. When we get closer to the week that we're doing this stuff, I'll explain a little bit more detail what's required. But when I showed this to you a second ago, before the break, there are two things in this with the cases and the outline link there. Now there's a third thing, which is an assignment, which is part of what I'll explain in the future about this test. But those things are there. So I just forgot to move this into this folder here. There it is. Also, I was thinking about, Paige, you were asking about practice questions in the pre-units. So I do have an alternative to that. I think I mentioned this last week. For what are the pre-unit assignments that I've decided I'm not going to continue on with this summer. They originally came out of this website called Learning Pod. And so they used to be called Learning Pod assignments. I don't use the Learning Pod website anymore because they've kind of closed down. They actually haven't closed down. They've just stopped supporting the website. So up at the top here, it says starting March 31st, 2015, Learning Pod will no longer be supported. So the company isn't putting any resources into the website. It's still there. And there are practice questions for this course here, and you're welcome to use those. And in fact, that's what the pre-unit assignments basically are. I'm assuming, since it's still on the web, that you can, in fact, sign up to do this. So you can go in here, make an account if it'll still let you. And let me show you what it looks like. hold on a sec. Oh, there we go. Um, so I have an account here, and I'm signed in, these are some of the assignments I did in demonstrating things. What you can do if you search for anatomy and physiology, maybe. Great, the search is kind of slow. Oh, there we go. There we go. So any of these that say anatomy and physiology, chapter, whatever, these are from the book. These are the practice questions in the book that we're using. And a pod is a collection of questions. So you could go to all of the questions that turn up in the search, or just the 56 pods that are in there. Unfortunately, it's not organizing it very well in the search here. They're all over the place, what's included. You also could, so when I did this search, it said 28 of the pods are from, here's our book. So you just click there and it'll take you right to the book. And now they're organized by chapter. So if you want to use this for practice questions, you can. I have additional questions that are based on the book, and I'm so if you search for my name, these are all of the pods that I've made. So they're the additional practice questions I've put together. Again, they're not really organized. Yeah, that well. But you can go through these and just look at the titles and it'll tell you what they're about. There's only 2 pages of them. So, and also what I try to do in the title for a lot of them is put the chapter name that they're relevant to. So obviously chemical level organization would have to do with some of today's stuff. So you can search for more there. I have no idea if this site will be functional enough for you to actually make an account so that you can use it. I don't know that you necessarily need an account to use it. So this is just the home page without being logged in here. And yeah, so you don't even actually have to have an account. You can go in and just search for anatomy and physiology and get to the book stuff if you want. If you have an account, it'll keep track of what you did. And so if you'd like to see how you did on certain things, you can, but it's not required. So, okay, you don't actually need an account. But also, as I was saying, I can't guarantee that you can make an account. I also can't guarantee that this site will be up forever. They've stopped supporting it back at the end of March, which I would think included actually hosting the site. So they might decide eventually they can't afford to even keep the website open, so it might just plain shut down at some point. But I've not heard anything about that.
Thank you.
Happening. If I get an email and they say, okay, we're now officially completely closing the website, I'll let you know. But you can go there for practice questions. They're still available there. So I want to talk about this case, and actually I want to write stuff up on the board. And when I'm doing that for recording purposes, I actually I'm going to just open up a word processor file, and I'll type stuff up on the screen instead of writing up it on the whiteboard. So what I want to start with in considering this is to just talk a little bit more about the point of using case studies in this class. Now I pulled this document out of the folder that says Lab Practical 1 because it's related to that exam. Now, if you've taken a lab science course previously, you've probably had a practical exam. In the context of A&P, the practical exam is sort of based on what a medical student in an anatomy class would be doing to test what they learned in the laboratory component of that. So in anatomy and medical school, they're dissecting a cadaver, and they're learning about the structures of the body by actually taking a body apart and looking inside and seeing what's there. To be tested on what they learned from doing that dissection, they're going to have a practical exam, which would essentially be, and this is just based on how this was done at the school that I got my graduate degree at. 4 students would all work on one cadaver together. And then when the test came along, they would go in, it depended on, they varied how they did it exactly. It might be 1 student at a time, or it might be all 4 students in a group together. Would go in, and the instructor would be there in front of the dissected cadaver and would point at the different structures there and basically say, okay, what's this, what's that, what's that? And that was a practical exam. The idea was that they were being tested on the practical material that they were working with, that they were being tested on what they did in lab. We don't do dissections in this class. What we tend to do is work with models, not this particular one, but it's sitting right next to me. Let's say those torso models over there. We might take those apart, or we might look at microscope sections that are prepared, which is what we'll be starting to do next week. And if I were to have a test along the same lines, I might take a model like this and point at something like this and say, okay, what's this thing right here? And that'd be sort of the same idea as the example from the medical school course that I was talking about. And a lot of my colleagues do that. Not necessarily just taking a torso model and saying, what's that? But using the models, whether it's these or the things are up on the wall, or microscope specimens, or the bones are on the bone cart back there for when we're dealing with the skeleton, et cetera, looking at those things and asking you to identify stuff that we've studied in the course. That's how a lot of my colleagues do it. I don't do it that way. There's 2 reasons I don't do it that way. The first one, which is kind of selfish, is setting up that kind of exam can be time consuming. The way that a lot of my colleagues will present that type of exam is on that day, you'd come into lab and the tables would have models and specimens and whatnot laid out. And you'd get a little, I don't have one on my card, but you'd get a little stapled sheet of papers that's the test. And you'd go from one spot to the next, looking at each station and answering questions about that, which might be, what is this? Or it might be, what system does this belong to, or it might be, what type of tissue makes up this structure, all sorts of different anatomy or physiology types of questions related to what you're looking at. Setting something like that up takes a good hour, and just physically setting it up, and actually developing that test takes a bit of prep. So selfishly, I don't really like doing that because it's a very time-consuming kind of test to set up. But the more important reason, the reason that really has more to do with you than me, is that I don't think that's a good way to test students in this class. Some of you might be going on to surgical technician program, something like that, where knowing where things are inside the body might be important. But for the majority of people taking A&P of this sort at this school, it's not really the point of the course for you. So I've reinterpreted the idea of the practical exam, and I want to give you a test that's based on real-world practical material. And so that's where the case studies come from. The case studies are real-world type clinical stories, clinical examples. And I like to use them, as I was sort of suggesting at the beginning, right before break, because it helps to sort of show you the underlying physiology and anatomy that has to do with that real-world example. And I say physiology and anatomy in that order because as I was describing how to get to know the material, symptoms and signs are really about the physiology, and that came first in my explanation, and then the systems is about the anatomy. So, but it's really just connecting those ideas to a real-world example like this. Now, how the test works in more depth, I'll talk about again when we get closer to it, giving you enough time to prepare for it. But I'm showing you this case partly to expose you to the kind of material that that test is going to be based on. In showing you this case today, I also want to take some time so that you can understand how a case like this can be useful to understand the basic A&P of this course. Okay. Now, the first thing that you want to be sure that you understand is the terminology. Okay. Just a second. I gave you a somewhat extended break because I wanted you in that time to look over this case. So now I'd like to start off understanding this case by making sure everybody understands the terminology. Now, like I said, I used to say underline what you understand. We'll talk about that as we discuss it. But especially in the last few years, people have at their disposal ready access to the internet. So you might have been looking at this and you might have looked up some terms on your phone or tablet or laptop or whatever you might have handy. So whether you did look it up or you haven't yet, what terminology are you not familiar with? Okay. Did you look that up?
I did.
What does it mean?
I think it says something like a change in the voice of a person who has pleural effusion.
Okay, so this is annoying. Just a second, I want to see if I can turn off the spell check thing so these underlines go away. Nope, go away. All right. Okay. So this is voice sounds with pleural effusion. Okay. Which probably gets us to what the hell does pleural effusion mean? Which is not in the case, but if you're looking up terminology, you need to be sure you understand the definition. So what's pleural effusion? Right, mucousy stuff going on in the lungs. Okay. Pleural is referring to things related to the lungs, especially the outer covering the lungs. And then effusion is just referring to excess fluid, I guess is one way to say it. I was a little surprised when you said pleural effusion, whatever source you looked it up on. That's not what I would expect it to be. I would rather stick with the mucousy stuff in the lungs because it's a better, more relevant to what we're talking about here. In that, what I'm talking about is the buildup of mucus in the bronchi and bronchioles of the lungs. What agophony is getting at is when somebody's speaking, if with a stethoscope you're listening to the lungs, you'll hear some extra sounds while they're producing speech. Okay, and so let's be kind of vague about what the cause of that is. Mucousy stuff is fine, because pleural effusion actually has a very specific meaning to it. So, yes.
This could refer back to the testing. If we put something like that in the test because it's in our own words, that's okay.
As long as it makes sense.
Fine. You know what I mean? Like we can use it our own way without any.
It's acceptable.
Okay. All right.
I don't want you to try to sound. Well, I don't want to say professional. Highfalutin. Let's go there. Saying, you know, oh, I'm going to use words that make it sound like I know what I'm talking about.
Right.
If you don't know what those words mean, then don't do that.
Okay.
But if you're just being real folksy and making stuff up all the time, I'm going to have a whole discussion with you. But yeah, I'd prefer that you keep to things that you do understand yourself than rather trying to polish your language to beyond what you actually understand or use yourself. Okay, so okay, another term. So I was actually a little surprised that agophony came up first because it's actually a little ways on into the case. Purulent sputum is one of the first things there. Now, we could define this as a term with two words there, or we could just define purulent and define sputum. And let's do it that way. What does purulent mean? Yeah, containing pus. Okay. And then what is sputum? Yeah, mucousy stuff. Okay. Specifically, what's being coughed up? So mucus is what's in your lungs. Sputum is that mucus once you've coughed it up. And so purulent sputum is just going to be that mucousy stuff that you cough up that has pus in it. And what is pus? Right. Specifically, what is it, though?
White blood cells.
Yeah, white blood cells. So things that fight off the infection. Okay. Now, we call them white blood cells because they have a whitish color to them. It's not relevant to this case, but purulent sputum will often have a tint to it, green, yellow, whatever. The color that it has actually tells you a little bit about what's causing the infection, but that's not terribly important here. What else?
Hyperglycemia.
Hyperglycemia. Now, one thing that I'd like you to think about as you're learning words for this course is that they're made up of parts that you're going to see over and over again. Okay. What does hyper mean? High or too much or above. What does the root glyce refer to? Yeah, sugar. Specifically, it's the same root as the word glucose. Okay. Oops. And what does the root eme mean? Blood, right. So hemoglobin, an important protein in your blood, has that root. It just has an H at the beginning. In the middle of the word, that root isn't going to have an H in it. Okay. Okay. And when something ends in an IA, what does that mean? No, it actually means condition. So it's a medical condition. So hyperglycemia literally means high glucose blood condition. Okay. What we would really mean as high blood glucose levels. Okay. Which we associate with what condition? Yeah. But just looking at what makes up that word, it told us exactly what it means. So, what else?
Cystic fibrosis.
Right. We're going to get into cystic fibrosis a little bit later on. It's the overall condition or diagnosis she has with this. Something else.
Exacerbation.
Did I spell that right?
Yeah.
Okay. What does exacerbation mean?
Like excessive? Like overwork?
You're in the right neighborhood, but it has a more direct meaning here.
Increase in severity.
Yeah, increase in severity. So it's the disease is getting worse, which is where you're kind of going there. She has cystic fibrosis. She's going into the hospital because the symptoms are increasing in severity. Okay. What else?
I didn't know what chest percussion were.
So you know what chest means?
Yeah.
You know what percussion means?
That's what I.
Percussion. All right.
Yeah, okay.
So yeah, those are words you might recognize, but together they have a very specific meaning. Now, yes, it does literally mean beating on somebody's chest. In this condition, since there's mucousy stuff in the lungs, beating on the chest is actually going to help loosen the mucus so that she can cough it up. But yeah, that is kind of a jargony thing. It's a particular treatment. Okay. I don't like the word beating here because it has other connotations. Let's go with pounding. Here's some highfalutin word for you. Thoracic wall instead of chest. But I think there's actually some devices that people can wear that'll kind of do that for them. But a physical therapist could just pound on somebody's back and help loosen that. Hold on a second. All right, there we go. I just want to get some of that space out of that. Okay, what else?
Gastroesophageal.
Gastroesophageal. What's that mean? What's gastro referring to? What is going on with this stupid thing? Yeah, I need to do that in a second. So gastroesophageal is referring to where the stomach and esophagus come together. I didn't do it. I usually use a different way of presenting, writing stuff up on the board. But one of my students last semester said, why don't you use Microsoft Word? So I'm using Microsoft Word. I'm not going to do it anymore. But anyways, so now I know the answer to that question. I don't use Microsoft Word because it's stupid. Okay. So what else? You understand? Pancreolipase. So again, by looking at the word, we can take it apart to some degree. And we're going to start at the end. When a word, or specifically referring to a medication or molecule, ends in ASE, that means what? Yeah, this is an enzyme. Okay. And usually with an enzyme, everything before the ASE tells you what that enzyme breaks down. Okay, it's not exactly true with this, but before the ASE, we have LIP, which refers to what? Yeah, lipids, like I was just talking about. So lipase is a lipid enzyme. Okay, now enzymes are proteins. To say lipid enzyme doesn't mean this is an enzyme made of lipids. This is an enzyme that breaks down lipids. Okay, and then the rest of the word, pancreas, is referring to what? Pancreas. Yeah, the pancreas. So this is an enzyme, I should say. Oh, I'm really not enjoying one Microsoft right here. Enzyme that breaks down lipids made by the pancreas. Okay. So that's basically what pancreolipase means. Okay, what else? Sorry?
Abbreviation, HE.
So I said, as I was talking about terminology, be sure you pay attention to the abbreviations. You've probably seen in a medical context the abbreviation ENT. What does that refer to?
Ear, nose, throat.
Yeah, ear, nose, and throat. Okay. So what things would be related to the ear, nose, and throat that would start with an H and an E? Yeah, so this is head, eyes, ear, nose, throat. Okay. So it's just the physical exam of the head with specific aspects of it, looking at all of those different components of it. Okay. What else? Okay. Okay, so what does tachycardia mean? A fast heart rate. And then you were also saying tachypnea, which is a fast respiratory rate. Now, both of these obviously start with tachy. And just to see what kind of background knowledge people have and trying to make some connections, what in your car has a name that includes that component? Tachometer, right. What is the tachometer? Not everybody's car has an obvious tachometer. Sorry? It's not the speedometer. Okay. Speedometer is a meter to measure speed. The tachometer is a different meter. What does it measure? No.
RPM.
Yeah, the rotations of the engine itself. Okay, speedometer is how fast your car is going. The tachometer is how fast your engine is turning over. Okay, so it's the speed of your engine. Okay, so yeah, same prefix there, or well, at least the tach part. Okay. Another thing I don't like about Microsoft Word, Microsoft basically just figures that people are stupid, so it does everything for you, like change font size. What you
Isn't that an EDA? Like, everyone is saying it's like a condition, like you've been diagnosed with something, like.
Wait, I'm sorry. Start that again.
Probably not, but the fast heart rate, like, is that something? Not something she normally experiences, right?
Oh, you're getting at the fact that it has IA at the end. Is that what you're saying?
Right.
No, that's.
I'm just referring back to that.
I suppose you could say that. Yeah, it's a condition of elevated heart rate. I never really thought about it before. Mostly because I think cardia is, or cardi at least, is a root. So whether it's cardio, something like cardiovascular system, or this. So the I think, is part of the root, and so the A is just sort of goes with that. I don't think the IA itself is a separate part of this word, but okay. What else?
I have a question.
Okay.
Do you post this Word document anywhere, or is it just going to be like?
This is going to be captured in the
video.
video, so you can look at that. What else?
What is flow vent of medication?
Right. So that's actually, of the things in that paragraph that people would ask about, that's the one I'd be least likely to predict somebody would ask about.
I know the other one.
You do know the other ones? Okay. We'll test you on that in a second. But flow vent is, sorry?
Is it the inhaler?
Yeah, it's an inhaler
Oh, okay.
for, what do we call that? Asthma. Not that she has asthma, just that she has problems breathing. But yeah, I'd be surprised if people ask about flow vent before, say, itraconazole. You know what itraconazole is for?
I looked it up and I forgot what that one was.
Okay, then you should ask about that one.
That was nice.
Did anybody look up itraconazole? No, it's actually, I don't know if that's true, but it's an antifungal. Okay, so we already know that she has a respiratory infection. Okay, so she's being treated with itraconazole. She's being treated with something else also. What else is going to treat the? Yeah, so she's getting antibiotics. What's the difference between an antibiotic and an antifungal? No. Sorry.
One's for bacteria and one's for fungus.
Yeah, antifungal is obviously
Yeah.
antifungal. It's against fungi. But antibiotics actually are specifically antibacterial drugs. Okay.
Question.
Yes.
Antifungal, usually it's a topical thing, right, usually?
Well, if
Like-
you're talking about like athlete's foot or something like that, sure. But
Or-
you can
or
have
anything,
fungal infections.
eczema, that-
Depends on where the fungus is. If it's a skin fungal infection, then it's going to be topical. But if
But
it's
there is, I didn't know there was oral
Mhm.
medication for fungal.
because we inhale a lot of fungal spores, so respiratory fungal infections are not unheard of. But usually when we think of fungal infections, it's usually on the skin, like athlete's foot or something like
What about FEV, 50%?
that. Okay. So FEV is another abbreviation. Did anybody look up what that abbreviation actually stands for?
Don't tell me fever.
No.
I didn't see it.
It's the last thing on the page. But you're not just going to recognize it. You have to have looked it up probably. Anybody? Okay. It is forced that's my typing. Expiratory volume. Okay. FEV, forced expiratory volume. It's attached for lung capacity, and somebody forces all of the air out of the lungs that they possibly can.
Like with an incentive spirometer?
Right, through a spirometer. And so the fact that hers is 50% is that in whatever time frame they're measuring, which is usually the first second, she's able to exhale 50% of her lung capacity, which is actually unusual, is not unusual. I mean, sure, it's unusual. It's indicative of her respiratory problems. I think a normal FEV for 1 second should be 60 or 65%. So she's not able to exhale as much as the average person would, which suggests that there's a decrease in respiratory function.
So the normal 60 or 65.
I might be guessing
Okay.
something like that. That usually 2/3 is a normal value for a lot of things, whether it's that or the amount of blood that your heart pumps per beat is 2/3 of its volume, that sort of thing. So I might be making up that exact number for FEV, but I think that's right. Anything else? Okay. What is prothrombin? So, does anybody know what thrombosis means? Clot, right. Okay. Prothrombin is referring to a molecule involved in the clotting cascade. Okay. When we see pro on the front of the name for a molecule like this, from the Greek, pro means before. So prothrombin is the precursor to an enzyme called thrombin, which is what's the enzyme that actually forms a blood clot. So prothrombin time is a measure of an aspect of blood clotting function. And for the sake of this case, specifically what prothrombin is isn't as important as it's just a measure of blood clotting time. Now, there are other terms in here that we could go through. We've covered quite a bit here, so I think this is fine. And I want to move on to the next thing here, which is the symptoms and signs. So here we're just looking at the story, and you should be able to pull out from this just references to what symptoms there are. So what symptoms are described in the case here? Okay, so I gave you the first one. She has a cough. Okay. SOB, not son of a bitch, but shortness of breath. Okay. Does it actually say chest pain?
No.
Okay. What else?
Weight loss?
How does it actually say weight loss?
She was admitted at 104 pounds and her usual weight is usually 112. It says it is.
Okay. Actually, what I'd rather put in here is that she has a low BMI. Okay.
You're looking for a symptom, though, right?
This would, well, it's not a symptom technically, it's a sign, but this is an indication. This is a more formal way of referring to the fact that her body weight is low. Okay. What is BMI?
Body mass index.
Body mass index. It's a ratio of body weight to height. And it's a very quick way of telling if somebody's body weight is appropriate for their size. Okay, so to say that her admitted at 104 pounds, or current weight 104 pounds, usual weight 112, of itself doesn't mean that she's lost weight. Well, I guess, yeah, it's a lower number, but doesn't mean that the 104 is necessarily a bad number. But her 18 kilograms per meter squared, is that right? Whatever. That puts her on the BMI scale in the underweight category. Okay. So, sorry?
If you're done with that, I have a question after you.
Sure.
What is a positive sweat chloride test? Does it actually test your sweat?
Yeah, it is a look at the composition of the sweat.
Okay, then sweat.
So pos for positive, Cl for chloride. Okay. What else?
What about her blood levels?
What about her blood levels?
They give you the norms, so they give you what her values are.
And you're referring to the albumin and pre-albumin stuff?
Yeah.
Okay.
They're out of range.
And which direction are they out of range? So she has low blood proteins. What else?
Mucus.
So what was the mucousy thing we were talking about earlier? Sputum. And how would we describe her sputum? Yeah, so he has the purulent sputum. What else? Okay, it is elevated body temperature, ET. What else?
What about her appetite? Go back to the low BMI.
Is there anything in the case that specifically says something about her appetite?
It says it hasn't improved.
Is that a loss of function?
Well, at some point it's low.
But the case doesn't say at some point it's low.
Okay.
So, don't read too much into the case just yet.
What about polyps?
What about them?
It said that one of the clients had nasal polyp.
So she has a nasal polyp. What's a polyp? That's a little growth. Nodule or something like that. It's a growth of a mucous membrane, so her nasal mucosa. She has a little polyp there. Okay. What else? Okay, so I'm just going to put blood clotting issues because there's actually a little bit more implied in there. What else?
Tachycardia and tachypnea.
Hyperglycemia.
Okay. Iris?
Tachycardia.
Okay. And
It says she has bronchi and respiratory wheezing.
okay.
And then you got
Actually, does she have agaphany?
no.
No.
Oh, no.
doesn't.
Yeah.
Tachypnea. But I have a question. When you visit a symptom, what if someone naturally has high blood pressure? I mean, a high heart rate and respiratory rate. What do
Well, if it's an abnormally high, it's a symptom.
even if it's someone who's been this way?
So they have a chronic condition.
Okay. All right.
Yeah, so her heart rate is probably elevated all the time, but there's something wrong with that. Yeah.
Mhm.
What else? Can we learn anything new from the medication she's getting? It's not technically symptoms or signs, but it does give us some information.
She's got reflux, esophageal reflux.
Right. So she's got gastroesophageal reflux. Whoops. Third. What else?
She has inflammation. She's on Prevacid.
She's on the what?
I think Prevacid is for inflammation.
Nope. Prevacid prevents acid,
Oh.
hence the name, and that's actually that's for the GERD. That's you take that for heartburn,
And,
She has diabetes.
which is the hyperglycemia, which you already have up there.
yeah, she's taken the antibiotics and the antifungal for something. So.
Well, that's the purulent sputum we already have up
Oh,
there.
it is. And the bacterial, that was for the antibiotics.
That'd still be the purulent sputum. Yeah.
Pancreolipase.
Why is she taking that?
Something wrong with her pancreas.
That's cystic fibrosis.
Well, yeah, all of this is about cystic fibrosis, but the pancreolipase is because she's not making these enzymes, so she has to take it. So that would suggest that she probably has low digestive enzymes. What else?
If she has peptic ulcer disease, does she have an actual ulcer?
Yeah. What else?
It's in bad shape.
I think we might have hit
It
everything.
says she's ill of hearing.
Yeah, there's not that doesn't help our cause here too much. We already know she probably doesn't fit. I think we've hit everything here. So, anything else anybody noticed? I think we got it all. Oh, actually, shoot. Oh, what'd I do? Okay, I'm trying to put 2 columns in here, which is one of the things I can do with Microsoft Word, theoretically, but I'm not getting in there. All right, so, okay, I don't think I'm going to be able to do this, but what I wanted to do was make a column over here that, no, shoot. we could just say for each of these symptoms, which system they're responsible for. So, which system is the cough related to? Respiratory. I'm just going to use resp because I'm going to be repeating it over again. Copy. Okay. What about the shortness of breath? I want to do all the respiratory stuff since I'm copying and pasting things here. What's the next respiratory one?
Wheezing.
The nasal polyp.
I think it's a purulent sputum. Okay. Then somebody said nasal polyp. And somebody said bronchi and wheezing and tachypnea. Any others that are respiratory? Okay, so let's go back up here. What is low BMI? Yeah, digestive. What's the next digestive system?
The digestion curve.
Third, esophagus, stomach, both part of the digestive system. Digestive enzymes. Actually, no. And where are the peptic ulcers? What does peptic mean? Means stomach. Okay, so it's there. Now, since it came up, what system is hyperglycemia actually related to? Nope.
Lymph?
Nope.
Endocrine?
Endocrine, right. So this is insulin is a hormone. So hyperglycemia is actually an endocrine function problem. All right. What system is the sweat chloride test going to be a sign from? Epithelium is not a system, it's type of tissue, but where's, yeah. So epithelial tissue is found all over the place, but specifically the skin or the integumentary system. Anything else here of the skin? No is an appropriate answer. Just being silent because I'm sure he's asking that question. I don't know what the answer is. If you don't think there's an answer, you can always say no. So, what system is low blood proteins going to be related to?
Circulatory?
Right. Or cardiovascular. What else is cardiovascular? Okay, before we get to tachycardia, we've got blood clotting. Okay. Tachycardia. And I think that's everything there. Nope. Oh, that, yeah. I don't want to put anything here next to elevated body temperature because while this is a symptom of a condition here, it's actually different from all the rest of these. It's not a loss of function. It's actually a function that's doing exactly what it's supposed to be doing. It's a sign that she's fighting off an infection. Okay, but for what I want to do next, we don't want to deal with that. It's an immune system function, and it's working perfectly fine, and it's supposed to be doing that. What we want to think about is what parts of the body aren't working properly. And so the fact that she has a fever is a sign that her immune system is doing what it's supposed to be doing, but it's doing it because the respiratory system has an infection. Okay, so if anything, it's kind of secondary to something we've already covered. But looking at this, we basically have the respiratory, digestive, integumentary, cardiovascular, endocrine systems all kind of implicated here. Okay. Now, one of the things I like to do in explaining this is a little bit lost in what I'm doing here because of how I did this. But in the past, as I'm doing this, I'm usually doing it on the board, writing it up on the whiteboard. I'm not doing that now because it's really hard to capture what I write on the board for video. So I do it on here. But let's pretend I've written this on the whiteboard. What we've done here is essentially what happens at the beginning of pretty much any episode of the television show House. Okay. Has anybody watched that show?
Yeah.
Okay. So it usually starts off with some weird sort of introduction to a patient, something's gone wrong, and they have to go to the hospital. The fictional, what is it, Princeton Plainsboro Hospital, somewhere in New Jersey, where House works. Now, besides the hospital being fictional, a doctor like House is also fictional. Makes for great TV, but there's no such doctor that could do what House does. My wife and I actually just started rewatching the series, and I don't think I ever really saw the first season too much, but he has a double specialization in infectious diseases and kidney, nephrology, that's what I'm looking for. And whilst there are certainly people that have specializations in infectious diseases and that sort of thing, they're not necessarily going to be the sort of jack of all trades kind of doctors. The point behind the show is the patient comes in with some weird kind of disease, and he's the only person that can figure out what it is. And there's not really any doctor like that. Doctors specialize, and they're going to specialize in a particular area. Even within infectious diseases, they're going to probably specialize within some organ system. And from what's stated in the show, he really should be more about the renal system than anything else. But he's all over the place, whether it's brain or I'm trying to think. What was that one I was just watching? We watched like 3 episodes last night, so they're all kind of blending together. But anyways, isn't Netflix great? So anyways, that's essentially what happens at the beginning of any episode is they just write down a list of all of the symptoms. Actually, one of the episodes that I was watching last night, it's kind of nice the way that they did it. It was this one where a nun was presenting with a really weird constellation of symptoms. And they wrote all these up on the board, and they were just sort of writing them randomly. Usually they write them in a list, but they were just sort of scattered on the whiteboard. And at one point, they're trying to figure out what's going on, and so they come up with a number of different diseases or diagnoses. And they just circle which of the symptoms fit, and they get this map of different diseases, and they decide, oh, it must be these 2, because those 2 overlap all of the symptoms. So, but anyways, that's the idea. They come up with this. Now, they don't do the next step, which we did. They don't sit there and figure out which systems are involved in each. But actually, that's kind of inherent in what's happening. Now, the point of using a case study in this class is to really think about how the functions and structures that we're learning about in this class related to a condition like this. In House, what they're trying to do is take that list of symptoms and get to a diagnosis. Now, in this case, we don't need to get to a diagnosis because the case tells us what the diagnosis is. She has cystic fibrosis. So we're not trying to figure that out. But in the House approach to figuring things out, they could certainly have this list of symptoms. And while they don't necessarily do it, laying out all the different functions, when things seem very weird, when they're saying, oh, why do they have all of these different symptoms? It's usually because all of those symptoms are different parts of the body, different systems of the body, And it doesn't make sense that there's one thing that would be causing all of those problems. Now, that's essentially the point of any house episode, is they have to find the one thing that's causing that disease. And I was mentioning the one I was just watching where they came up with a bunch of different symptoms. And I'm going to put this on the whiteboard just because I can't do this on the screen very well. But I don't remember what they were right now, but maybe, you know, fever, swelling, rash. I can't remember all what it was, you know, low BP, et cetera, et cetera. They're writing a bunch of things up on the board. And then what they decided to do was to start thinking about what diagnoses would fit with that. And so he started circling, okay, these are all one, these are another, this is another, so that sort of thing. And the point that they were getting at was there was some two outlines that he came up with that covered everything. So he said, well, the best explanation is that she has these two conditions. Okay? It accounts for all of the different symptoms, and it makes some sort of sense. And they immediately said, no, Occam's razor. Okay. Does anybody know what Occam's razor is? Anybody heard that term before? So Occam is O-C-C-A-M. And in fact, this is the title for the episode that I was watching the other day. There we go. Okay. Occam's razor. So that's actually the title of the episode. Does anybody know what that refers to?
The easiest explanation is usually.
Yeah. And that might almost be a quote from the episode. What you just said, I think, is exactly what Foreman said. Okay. So in that episode, House says, well, these two things must be both happening at the same time. And what they're saying is, no, that can't be. The chances of somebody getting two diseases at the exact same time presenting together is astronomically small. So there has to be a single cause for everything. And that's largely the dramatic tension in any episode of House. They're trying to figure out what is that one thing that they're trying to figure out. What is that one thing that's causing the disease? And oftentimes what they do is they get to a point where they think they know what it is and they treat it. Often it's, it takes 48 hours to actually test to prove it, but we can start treating it right away. And if they get better, then we were right. And of course, every time they do that, the person gets worse because it's like at about the 20-minute mark in the show, and they want to, get the drama rolling. In looking at all of the symptoms and the systems that are involved, what we want to do is say, okay, what one thing ties all of these together? Now, we know with this case that one thing is cystic fibrosis. What we need to think about for this course is, why is cystic fibrosis going to have all of these different effects? And it really does come down to Occam's razor. There's one thing that really ties all of these symptoms together, and it's at the root of the cause for cystic fibrosis. Okay. Now, sorry?
There is like one main question to answer, what was it again? There's one thing that we should be looking at.
Oh, yeah, so we're getting to that.
Oh, okay.
I'm setting up the answer.
Okay, I just can hear, I don't remember the question.
What's causing this disease? I guess.
Okay.
Now, the fact that we're using case studies to learn about stuff in this class actually gets at that question from a different direction. Okay. Why are we looking at this case study today? What's special about today that we want to look at this case study now? No, that's what the case study is telling you. But why are we as a class taking time to talk about a case study today?
Because it's our lab time.
Are we studying the respiratory system? No. Sorry?
Because of what's going on inside the cells.
Yeah, so it probably has something to do with what we're doing today, which is actually we're looking at biochemistry and cells today. And specifically, it's the second half today, which I said was about cells. So what all of these things essentially have in common is that the same kinds of cells are at the root of all of the functions that are compromised here. Okay. Now, there's a bit more necessary for that explanation, but that's essentially what it is. Now, really, this case, I like to do it at the beginning because this case is a good way to look at all of this early stuff. So the molecules, the cells, and then tissues, which is what we're going to be getting onto next time. That first unit in the book, the chapters 1 through 4, the whole section, the whole unit is described as the levels of organization or something like that, I can't remember. And while chapter 1 is just called the introduction. Chapter 2 is the chemical level of organization. Chapter 3 is the cellular level of organization. And chapter 4 is the tissue level of organization. What that unit, that the beginning of the book is getting at, is that everything else that we're going to be covering comes out of or is built upon those levels of organization. Okay. Now, I think in chapter 1 it goes on to talk about all of the levels of organization. So from the chemical, cellular, tissue levels of organization that cover in the first, second through fourth chapters. Then we're going to move on to think about organs and systems in the whole organism. So those are the levels of organization. And this case, I think, is a really good way of seeing how those lower levels of organization, chemicals, cells, and tissues, really inform how the whole organism works or whole organ systems work. Because it really comes down to how those lower levels impact how bigger things work. Okay. Now, to get into understanding what's going on there, is going to take more than 5 minutes. Okay. So I want to stop with what we're doing now. It's a nice stopping point. And next week we'll pick up, continuing to talk about this case and considering some stuff about cells and how that applies to tissues, which is really what next week's topic's about. Now, following the progression of this course, this week is about chapters 2 and 3, the biochemistry and cell biology stuff. And they each have their assignments, which are due for next week. I don't go into all that stuff in a lot of detail. I told you that you probably should go back and look at the recording lectures from last semester that look at the basics of cell bonding, that kind of thing. And then what I did this morning is I sort of went through a quick overview of a few inorganic molecules like water and salt and those sort of things that are relevant, and then the macromolecules. Okay. when we're getting to understand more about cystic fibrosis next week, we're going to be looking at how some of those macromolecules work with the cell membrane and that sort of thing. But I don't usually go into a lot of detail about the cell stuff at this stage. You're responsible for being familiar with those chapters and getting into that and completing the assignments there. Keep in mind the due dates for those assignments while they're officially by midnight before you come into class next week. Don't affect your grade. So if you're working on stuff over this week and you have 2 chapters worth of stuff this week, if you're not entirely comfortable with material and you want to hold off on some of that stuff and you're doing it late, that's fine. If you want to hold off till next week to complete some of that work, or feel free to ask me questions by text or email over the coming week as you're working on stuff. If you don't understand questions or you're not sure if what you're about to submit for an answer is appropriate, feel free to run it by me first and I'll give you some feedback. Just understand that I might not be able to get back to you immediately. I'll try to, but like Friday, I have this big thing that I've got to go to. Friday, I've got this big thing here in the department that we're like getting new furniture for all the rooms. And so we're doing this like really complicated walkthrough to assess everything. And then Monday of next week, I've got this big thing I've got to go to that I probably won't be able to get on, respond to text, that sort of thing very quickly. But feel free to text or email if you have questions, and I'll get back to you as soon as I can. Don't feel that you have to submit things by the due date. If you're waiting to hear from me or if you're not sure about things, it's not going to affect your grade to complete any of that stuff. So it's more important that you understand what you're submitting and you get them right rather than get them done on time. But with this material, I am kind of expecting coming into the class like this that you have some understanding or background in it. So you should, I think everybody should be able to do the work for this week on their own, even though I didn't go into it in a whole lot of depth here in class. So with that, I'll leave you to fend for yourselves over this next week and feel free to ask questions if need be. And I'll see everybody next week.